Hi everyone, I'm Chelsea with Nourish for Life, and today we're going to talk about the two first diet changes that you should focus on when you're diagnosed with POTS. So with POTS, one of the biggest issues is many people with POTS have what we call low blood volume. So, if you have this issue, you want to discuss it with your doctor. The first thing that your doctor will probably recommend is increasing salt and water intake. So those are the first two things you want to focus on. We're going to talk about those today. So increasing salt intake. What does this mean? Well, normal American diet has around 3,000 milligrams of salt per day. And what we're looking for with POTS is a higher intake typically. This can be personalized. You'll want to talk to your doctor. And some people with POTS have high blood pressure. The salt still can be helpful, but you want to talk to your doctor about how much and monitor symptoms carefully. But with POTS, some research from Vanderbilt last year showed that people with POTS improved with 7,000 milligrams of sodium intake per day, And so with that, that's a lot of sodium. So when we're looking at increasing salt in the diet, of course, you can do things like eating salt-rich snacks like pretzels and potato chips and things like that, but you really don't want that to be your primary intake. If you're dealing with a chronic illness, you probably don't feel great already. And so packing your body full of highly processed foods will probably not make you feel any better. So if you can, try and incorporate salt in whole foods as you're able to. Things like whole cooked grains, rice, quinoa, if you're having pasta, putting salt on your veggies and your proteins, like your meats or your eggs. And so those are the best ways to get salt in and naturally in whole cooked foods. Another sneaky way to get salt in is through sauces. So this is a good way if you're someone like me who doesn't prefer the taste of salt but really needs the salt. So using things like a curry sauce, Asian food sauces like soy sauce or teriyaki sauce. It could be barbecue sauce, and it could be things like soups or gravies. Those can be good ways to disguise a lot of salt in a smaller quantity. And you're using things like curries and soups. They can be really healthy as well. So they can be a great way to get a lot of salt in without having to compromise flavor and to make it more palatable. So that's a good option. And another option, which helps with your fluid intake as well, is drinking electrolyte-rich drinks. So you can look at different options. Pedialyte tends to be a really good option, has a great balance of carbohydrates, potassium, sodium, calcium, magnesium. Other things could be like Liquid IV is another one I really like for the distribution of sodium, potassium, and carbohydrates for best absorption. And other things can be like homemade broths or broths that you buy from the store. Those are really easy ways to get a lot of salt in, or a little extra salt at least, with fluid as well. And that leads us right into getting more fluid. So when we talk about salt, we have more salt because it helps us to retain more water. The saying goes, where sodium goes, water flows. So we want to get that salt in and then also get adequate hydration so that our blood volume can increase. And so with this, typically the minimum amount recommended is about 2 liters a day. Now, this is certainly individualized based on your age and your size. You can discuss this with your doctor or your dietitian, what your specific recommendations are. But typically it's recommended a minimum of 2 liters a day, going up to 4 liters a day. And that's typically what's recommended. This can change depending on, if you're an avid athlete, if you exercise or if you work outside, if you sweat a lot, those things can affect your fluid needs. Also, having high protein intake or more fiber intake can require a little bit more water for digestion and for your kidneys to process protein. So those are some things to keep in mind. Getting adequate water. So of course, just drinking plain water is a great thing and a really good way to get that hydration in. If you have trouble drinking large amounts of water, you can always use things like herbal teas that don't have caffeine. And then we talked about the electrolyte drinks and the broth. Even iced herbal teas can be a good option. You can also do things like popsicles. Smoothies are a good way to get some hydration in because fruits contain some water as well. And so either having smoothies or having something like watermelon or cucumber as a snack can be a good way to sneak a little extra fluid in without actually drinking anything. So there can be different ways to get more fluid in that you may not necessarily think about. Soups will also contain fluid that will count towards your total intake. And so while it may not make a huge difference, every little bit does help, especially if you're someone that struggles with taking enough fluids in per day. So again, you want to discuss any dietary changes with your personal doctor and your dietitian. This is not meant to replace their personal advice or their individual advice, but I hope this is helpful for you. Please like and subscribe if you'd like more content like this. And thank you for watching. Have a great day.